Hi, I'm Dr. Sarah Collins, and today I need you to listen very carefully. Because what I'm about to share could completely change the way you approach your health after 70. Have you ever wondered if some of the routine tests you're doing every year might actually be doing more harm than good? Or maybe you felt that twinge of doubt after a checkup, but didn't know who to ask. If you've ever worried that something as simple as a scan or test could trigger a cascade of unnecessary treatments, invasive procedures, or even serious side effects, this is the video you absolutely cannot miss. I promise you, in the next few minutes, you'll discover 5 medical tests that seniors are frequently advised to take, which might actually compromise your well-being instead of protecting it. This isn't just speculation. It's based on scientific studies, real-life experiences, and decades of observations in senior healthcare. So before you book your next appointment or agree to another test, stay with me. What I'm going to tell you could save you months, even years of unnecessary stress, procedures, and discomfort. Every year, millions of seniors dutifully follow the recommendations of their doctors, thinking that routine health checkups are their safest bet. But the truth, which very few are told, is that as we age, certain tests can actually trigger more problems than they solve. For individuals over 70, routine screenings for conditions that might never cause symptoms can set off a chain reaction of medical interventions, anxiety, and sometimes irreversible side effects. Imagine going in for a test that seems harmless, only to find yourself facing medications, surgeries, or complications that you didn't need in the first place. It happens far more often than most people realize. Recent research indicates that nearly 37% of tests done on seniors lead to unnecessary treatments, complications, or long-lasting negative effects. Astonishingly, 99% of people over 70 have no idea that many of the tests they undergo may be more risky than beneficial. Take, for instance, one of the tests that sits at the top of this cautionary list. A test that has been linked to a significant number of cancer cases in older adults, a figure comparable to alcohol consumption in its risk. This is not something you'll find advertised on billboards or casually mentioned in brochures at your clinic. But it is meticulously documented in the scientific literature, and today I'm going to walk you through everything you need to know. We'll examine each test, explain why it can be dangerous, and discuss safer, more effective alternatives that empower you to maintain your health without unnecessary risk. Let's begin with bone density scans, also known as DEXA scans. At first glance, this test seems completely harmless, quick, painless, and free of needles. You leave the office with a report on your risk for fractures, feeling like you've taken a proactive step. But here's the catch. After age 70, a DEXA scan often creates more anxiety than actual benefit. Bone density naturally decreases as we age, just like wrinkles or gray hair. And in many cases, the results suggest a problem where none exists. Seniors are then pushed toward medications like bisphosphonates, which are marketed to strengthen bones but carry serious side effects including jaw deterioration and esophagus irritation. Studies show that treating mild bone loss in older adults rarely reduces actual fracture rates in a meaningful way. For example, one study tracking women over 70 found that these medications lowered fracture risk by just 0.3% over 5 years. Meanwhile, the side effects can be significant, including digestive issues and even increased bone fragility in some cases. Let me tell you about Rose, a lively 76-year-old retired piano teacher. Rose had never fallen, experienced no pain, and walked daily. Her DEXA scan showed mild osteopenia, and her doctor started her on a bisphosphonate. Within 3 months, she developed severe acid reflux and jaw pain, and she had to stop playing the piano she loved. Once we switched her to a regimen of vitamin D, resistance exercises, and a calcium-rich diet with leafy greens and sardines, her strength improved, her balance stabilized, and she avoided fractures altogether. Her scan had created unnecessary stress and risk, and yet, the lifestyle changes she adopted provided far more benefit than the medication ever could. Next, consider brain MRIs for mild memory loss. Many seniors experience occasional forgetfulness, and the fear of dementia is real. Doctors often order MRIs to look for underlying causes, but most scans show normal age-related changes like slight brain shrinkage or white matter spots. In fact, a 2021 study of over 3,000 seniors found that 86% of MRIs indicated abnormalities, but only 3% were linked to treatable conditions. That means 97% of people experienced stress and fear over results that were essentially normal. Some even underwent invasive procedures unnecessarily. George, a 74-year-old retired engineer, had his white matter changes flagged on an MRI. Panic set in. He stopped driving, stopped attending church, and his anxiety worsened. Yet standard cognitive tests confirmed his memory was normal. Through sleep optimization, hydration, and brain-stimulating activities, his cognition stabilized, proving that a simple, non-invasive approach is often far better than rushing into a high-tech scan that may cause more harm than good. Finally, we come to cardiac stress tests, which are extremely common for seniors with mild fatigue or occasional chest tightness. This test monitors your heart while you exercise or receive medication to simulate exercise. While it can detect blockages in adults over 70, false positives are alarmingly common, up to 40%. These false alarms often lead to stents, bypass surgery, or other procedures with no actual survival benefit, but significant risk including kidney damage, bleeding, and extended hospital stays. Raymond, a 75-year-old retired postman who walked daily, underwent a stress test and ended up receiving a stent for a minor narrowing. That night, he developed kidney problems from the contrast dye and spent 6 days hospitalized, yet his initial fatigue had nothing to do with heart disease. Sometimes, simply monitoring your health with resting EKGs or low-radiation coronary scans, along with hydration and rest, is safer and smarter. This is just the beginning. By understanding which tests might actually harm you, seniors can take control of their health with confidence, avoiding unnecessary stress, procedures, and complications. Remember, proactive health isn't about doing every test possible. It's about making informed choices that truly protect your well-being. In Part 2, we'll uncover the remaining tests, including procedures many people never realize can carry significant risk, and discuss the safest, most effective ways to monitor your health after 70. Hi, I'm Dr. Sarah Collins, and welcome to the final part of our series on senior health screenings and how to make smarter choices after 50, 60, and even 70. By now, you understand why not every routine test is necessary, and how unnecessary procedures can sometimes do more harm than good. In this segment, I'm going to focus on practical, actionable steps you can take to protect your health, stay independent, and maintain your energy and quality of life. Let's start with bone health. Osteoporosis screening is recommended for many older adults, but here's the reality. Not everyone needs frequent scans. A simple bone density test is enough to guide prevention strategies. What really matters is lifestyle. Weight-bearing exercise like walking, light strength training, and resistance exercises strengthen bones naturally. Nutrition is crucial. Ensure you're getting enough calcium, vitamin D, and protein. Supplements can help, but only if necessary. Mary, a 68-year-old, improved her bone strength in just a few months by focusing on these habits instead of constantly worrying about repeat scans. Next, let's revisit heart health. Many seniors feel pressure to get every heart test, from echocardiograms to stress tests, even without symptoms. The truth is, your daily habits impact your heart far more than routine imaging. Walking daily, managing stress, eating a heart-friendly diet, and controlling blood pressure and cholesterol levels are the most effective ways to prevent heart disease. Taking medications as prescribed for existing conditions is important, but over-testing can lead to anxiety and unnecessary procedures. George, 72, reduced his risk of heart problems not through repeated tests, but by adopting a consistent exercise routine and improving his diet. Mental health is just as important. Cognitive decline and depression are common concerns, but early screening and awareness make the biggest difference. Instead of relying solely on tests, focus on mental engagement and social connection. Reading, puzzles, learning new skills, and maintaining friendships stimulate the brain and protect memory. Seniors who stay socially active and mentally challenged tend to have better outcomes than those who only rely on medical testing. Now, let's discuss medications. Many older adults are on multiple prescriptions, sometimes unnecessarily. Over-medication increases the risk of side effects, interactions, and hospital visits. Regularly reviewing your medications with a trusted healthcare professional can reduce risks significantly. Ask questions. Do I still need this? Are there safer alternatives? Could lifestyle changes reduce my need for this medication? Taking charge of your prescriptions is just as important as understanding which screenings to skip. Sleep is another powerful, often overlooked factor. Seniors often experience changes in sleep patterns, and poor sleep affects heart health, memory, mood, and immunity. Focus on sleep hygiene. Maintain a consistent sleep schedule. Limit caffeine late in the day. Avoid screen time before bed, and create a calm, dark, and quiet sleep environment. Good sleep enhances all aspects of health and reduces the need for some interventions. Nutrition cannot be stressed enough. Eating a balanced diet rich in vegetables, fruits, whole grains, lean protein, and healthy fats provides the nutrients your body needs to maintain strength, immunity, and vitality. Hydration is key. Older adults often feel less thirsty, leading to dehydration, which can cause dizziness, kidney issues, and other complications. Simple habits like keeping a water bottle nearby and eating water-rich foods make a big difference. Finally, the key takeaway is this: focus on what truly matters for your health, rather than chasing every routine test. Listen to your body, pay attention to symptoms, maintain a healthy lifestyle, manage chronic conditions, and consult your doctor when necessary. Avoid unnecessary procedures that carry risk, stress, or complications. Empower yourself with knowledge. Ask your healthcare provider why a test is recommended, what the risks are, and whether alternatives exist. Remember, it's not about avoiding medical care. It's about making informed, strategic choices that enhance your independence and quality of life. Seniors who take this approach feel more confident, energetic, and in control of their health, without the constant worry of unnecessary screenings. So, whether you're 50, 60, 70, or beyond, start applying these principles today. Focus on lifestyle, manage your chronic conditions wisely, prioritize mental health, and make every medical decision intentional and informed. By doing this, you'll not only live longer, but live better, active, independent, and vibrant. Thank you for joining me in this series. Remember, your health is your greatest asset, and with the right knowledge and actions, you can protect it and enjoy life to the fullest. Stay informed, stay active, and take charge, because being proactive is the true secret to thriving in your golden years.